we have Dr. Donna Flowers. She has. I'm going based on her LinkedIn profile, and she really has. She wears many hats and many skills. And one of them is a couple of them is family medicine, business development, executive coaching, and having also wellness programs. She is a medical doctor and a business matchmaker, is what she would say. She said, as a board certified family physician and entrepreneur. Am I getting it right so far, Doctor Dunn? Oh, very
Quite
good.
good.
She she understands the challenges of business that business owners face. That if you're in northern New Jersey and looking to sell, she's able to achieve that in the least amount of time and with minimal disruption and ensuring a smooth operation until the deal is complete. So she's also having been herself a former owner operator of both primary care and also urgent care offices. She does understand that selling a business can be complex, and it does require intentional confidentiality and also system and strategies. Um, on that, she that talks about the entrepreneur side. We're going to talk about medication adherence. We're talking about different apps that are also available, to which she will talk much more. But I am seeing more and more doctors who have gone into the practice with wanting to help people, but then in the system, once they get into the system, it becomes really hard with meeting quotas, with the stress, with just the infrastructure that sometimes does not fit with doctors. Either they go on practice on their own, or they're still there, and you have that um, quality and life balance that is not balanced. And sometimes you get a lot of burnout, and she is there to help to kind of smooth things out if you're looking for something that is different. And she's able to give perspective. First you have to be with like-minded people, and then as you find your way of exit, I would say, and into more purpose and into more fulfillment. So without further ado, I'm going to pass it to Dr. Donna Flowers. We have Chris, who's going to do that logistic for us.
Excellent. Thank you so much for the wonderful introduction and for the invitation to address the audience. I do miss my days at the NAACP in Montclair, so this is inspiration to get back to that. And this topic is near and dear to me. I started sharing my screen with you. Can you all see it?
Yes.
Okay, excellent. I wanted to also start by asking if there's any specific questions. I do have topics that I'm going to go over, but are there any burning questions that maybe I can address? No burning questions. Okay, great. So I really want to speak about the importance of following up with your PCP when your results are abnormal. And we're all professionals, right? Some of us are in the healthcare space. So it seems a bit odd. Why am I talking about following up with your PCP when the results are abnormal? But you'd be surprised, well, or maybe not. You know that they say physicians and nurses are the worst patients, right? And so it's actually not uncommon to have abnormal results and to have patients not follow up. But at the end of the day, even heroes need heroes, right? So we do definitely have to make sure that we're creating an environment in a community where we are taking care of ourselves and prioritizing our self-care. There are so many reasons for this. Your health is your wealth. I call health that invisible thread that really keeps everything together. So we'll talk a little bit today about why follow-up matters, the role of the primary care physician, and some of the barriers to following up, how to overcome these barriers, and the power of following up. And I'll share with you two really mind-blowing stories that happened with me as a physician with patients following up. And we'll talk a little about in that story what happens when people do not follow up. the role of prevention, and really to conclude, we'll go back to the beginning and say your health is definitely your wealth. So one of the things that I want to talk about is really advocating for your health at every age and stage. It's actually interesting because now that I'm into helping the boomers, those who are retiring, sell their practices, I hear a lot about the anticipation. Oh, I'm of a certain age. I expect my body to fall apart. I expect to get sick. And these are healthcare providers. And the reality is we don't have to really fall apart when we are aging. There are ways to age gracefully. And so it's really important if you have a high blood pressure, if you have an elevated glucose, or if there are any signs of any other abnormality, catching them early can actually really preserve your health. And as you well know, your health directly impacts your economic stability, your ability to generate generational wealth, your ability to sustain with your family, right? To run with the children or the grandchildren, your ability to work, and your ability to really take part in your community and the activities of your community. So I always say advocate for your health at every age and stage, and advocate for being healthy. Why does follow-up matter? Well, in the US, nearly 50% of people with abnormal results do not follow up with their provider. This is a mind-blowing statistic to me. When something unusual happens with your medical results, it's definitely easy to ignore it. A lot of people go into denial, even, right? But delaying it can mean that treatable conditions become worse and potentially even fatal. And we'll talk through a story about that later. Amongst healthcare providers and just high functioning people, high achievers, many people tend to feel overwhelmed by their daily responsibilities, by their work, by family, by finances, by life stress. And these things that cause burnout, which is already a neglect of health, cause people to further neglect their health. So I advocate for self-care. You talked a little bit about work-life balance and self-care, Anna, earlier. Really important that we are practicing self-care so that we can really rise to the occasion of whatever it is that we're doing. Thank you so much. So following up isn't just about responding to a diagnosis either. It's also being proactive to actually go out and to seek care for whatever it is that ails you that's appropriate for your age level, right? Also making sure that we do things like sleeping. Sleeping is like, the S word. It's interesting because I meet with a lot of women, especially who say to me, I'd like to lose weight. I've been going to the gym. I'm doing everything, but I can't lose the weight. And I'll ask them, well, how was your sleep? Oh, I get about, 3 to 4 hours a night. Well, just the stress of not sleeping can impact your health to the point where you're doing all of the right things, but won't get the results. It keeps your cortisol level elevated. That leads to hypertension, that leads to diabetes, it leads to weight retention, and all sorts of other things, hair loss, skin problems. So sleeping, the S word, is very, very important. So we often the primary care provider. Now, usually I'll have this conversation with people who have a cardiologist, a nephrologist, oncologist. So they have multiple specialists. What the role of the primary care provider is really to take what everyone is saying and to paint a holistic picture for the patient, to really help coordinate your care so that if you do need to see a provider, you're able to do that. And if you're, let's say the nephrologist, the kidney doctor prescribes the same thing that the heart doctor prescribes. As a primary care provider, we're reconciling these medications, we're reconciling the therapies, and really creating a holistic picture for you. And really being your advocate, helping you to advocate for yourself. A lot of times when patients are not necessarily being proactive with their care, it's the PCP who has that list to say, you know what, you're due for this exam, you're due for that exam. Have you taken these steps? So we are really your advocate. So what are some barriers to following up? Work-life balance, time constraints, honestly, should be number one, two, and number three. I just got off of a call with an attorney who's very high functioning, and it's way overdue for a follow-up. And he's like, oh, I just came back from this state, and I'm traveling to that state, and when I get back, and oh wait, no, I have to go out of town, and it's just so much happening. So we really have to be intentional to slow down, open our calendars, and schedule ourselves into our calendar. This is when I'm going to the dentist. This is when I'm going to my primary care. This is when I'm going to the spa for a massage or any other thing that really speaks to your health care. Really, for this audience, I don't know that financial constraints or lack of health insurance is a factor, but those are real factors. And confusion about coverage. It's interesting because I just changed employment, right? So I'm working with a new company, and my insurance changed. And guess what? My primary care does not take my new insurance, which means that, it's not that I'm confused about coverage, but now I have to either decide to pay out of network benefits or switch providers. And who wants to switch a provider, right? So these are very real barriers. So the other thing, which I think is very top with time constraints, is the fear, anxiety, and uncertainty. Not necessarily about what the result means, right? But just the finality of a result, right? So we automatically think bad result, I'm 1 foot in the grave. And I hear that, and I find that I have to talk a lot of people off the ledge. There are a lot of new technologies and honestly, even older remedies that are available to keep us in prime health, even as we age, so that certain things don't necessarily have to be final, right? So you have high blood pressure. That doesn't mean in like 5 years you're definitely going to have a stroke, right? It does mean though that we have to do what we need to do to lower that blood pressure, to change the lifestyle so that you can have a healthy outcome. So sometimes again, you feel like there's no energy left for your health, but that's really when we have to take the time and be intentional to pour back in, because you can't run on empty, right? If you're feeling overwhelmed, that is definitely your body saying, slow down. It is definitely the body saying you have to take better care of it. And we talk a little bit about the cultural perspective, right? There is a longstanding mistrust within the healthcare system, particularly amongst communities of color, that's rooted to historical and even present day injustices and inequalities. This can lead to avoidance and reluctance in seeking care. I often get asked the question, why did you become a doctor? And I remember one of my reasonings as a child. I saw how my grandparents, my aunts, and my uncles were treated when they went to the hospital. Right? They didn't necessarily receive the same treatment as other communities, but they had the same ailments, and they came in, with the same disposition of wanting care. And so those are very real things that as providers we have to be conscious of. And as patients, I'll say you have to advocate for yourself. The most important thing is to never give up. Your health definitely matters, and your advocacy starts with you. You are the one who can change the trajectory of your health. So we talk a little bit about learning about your health conditions. As much as we are not fans of Dr. Google, right? Google or reading up on what your illnesses are, it is important, but don't take that as gospel. Take that and discuss it with your primary care provider. Okay. And engage your family, your community leaders, your peers. I have one patient who had cancer and couldn't drive herself to her appointment. So she developed a system where her neighbors would drive her family would drive her, right? So a lot of those burdens were removed from her because she enlisted her community. And burnout self-care strategies are critical. Setting boundaries is key. Scheduling your appointments and asking for help when it's needed is definitely key to preventing and to recovering from burnout. It's actually funny. I had a conversation with a friend yesterday, and she recently lost her husband, and she had 4 children, and she said, it's hard for me to ask for, and like she stumbled over the word help, right? it's very difficult for those of us who are givers, who are in service to others, to ask for help. But again, every hero needs a hero. So I always say, obviously, we can't ask for help from just anyone, right? Because not everyone can, as I like to think of it, carry our weight. But there are definitely those of us who are capable of helping one another. So I encourage you to identify those individuals, those communities, build them so that you have them for your reference. So I want to tell you a story about a patient that I had. Her name was Sherry. So Sherry came in, it's about 2018. So Sherry came in for high blood pressure, mildly elevated, 140 over 90. But when Sherry came in, she just didn't look good to me. She didn't look okay. And so I said, you know what, Sherry, let me give you some medication and we'll recheck in about 15 minutes or so. So I gave her some medication in the office. This was an urgent care setting. And I came back, I rechecked her blood pressure. Sherry's blood pressure is even higher. And Sherry's like, you know, doctor, you're really busy. It's okay. I'll finish the medication at home. I'll go take a nap and I'll come back in. Well, at that point, as a provider, I advocated for Sherry. I said, Sherry, I'm busy, but what's another blood pressure check? Just give me 15 minutes and I'll be back. So in 15 minutes, I come back. Sure enough, Sherry's blood pressure is even higher. And Sherry just didn't quite look good to me. And so I said, Sherry, you know what? Rest. I'll come back in 15 minutes. 15 minutes go by, I go back into Sherry, and Sherry at this point is leaning against the wall. I said, Sherry, are you okay? And Sherry starts to slur her words. I said, Sherry, stick your tongue out. And she stuck her tongue out and it went to one side, whereas it's supposed to go straight. So here Sherry is in my office actually having a stroke. So we stopped everything and we called 911 and Sherry went to rehab. I didn't hear back from Sherry for a year and a half. So she called the office one day. Hey, is Dr. Janelle Flowers still working? Yes, I happen to be working that day. Hey, Sherry, how are you? Oh my gosh, I haven't heard from you in so long. How's it going? She said, Doc, I just got out of rehab. It was a year and a half later. She said, if you did not intervene for me, I probably wouldn't be here today. The distance that it took from her house to the office, if she would have been driving, having a stroke, who knows? She could have had an accident with other people. Others could have been hurt. So it's really, really important that you advocate for yourself. So she advocated for herself. She came into the office. That was the first step. And I advocated for her when she wanted to leave, and I knew something was off. Second story is Anne's story. And I really love the next quote. It says, my decision to follow up saved my life. I'm healthier now and I could be there for my family. So Anne's story is very similar. So Anne came into the office and she had abnormal stool, right? So, oh, you know, it's really nothing. I think it's okay. I think it's okay. I said, Anne, I think it's important that you get a colonoscopy done. Oh, doc, you know, I'm not 50 yet. I don't think I need a colonoscopy, but you're having abnormal stools. I think it's important that you get it done, Anne. So she says, okay. So she got the colonoscopy, and sure enough, she has stage 3 colon cancer, right? And she's not even 50. So every hero needs a hero. Everyone who walks in my office is a hero, and their first step of advocacy is coming into the office. And it's my responsibility. I see it as advocating for them as well. You know, we've talked a lot about building a culture of health advocacy, patients going into the physician's office and the physician also advocating for the provider. So it's not about one person, it's about the community. It's really about the entire system. And I know the NAACP has had a long history of championing the rights of health marginalized communities. Advocating for one's health is tantamount to activism. It is a form of activism. It's empowering our individuals, our families, and our communities to break through the barriers that impact our health and the barriers that will ultimately impact wealth and generational wealth building. So I really would like to speak on empowering yourself and others in your community to ask questions about your health, to make appointments, and to follow up. So what happens if you miss an appointment or if you don't follow up? So as we talked about earlier, missing out on those treatments for something that's early stage can actually lead to serious consequences. Had Sherry not come in for her blood pressure check, or had I not continued to check it, she could have had a serious outcome, more serious outcome that was not detected early and cost her and others their lives. It also comes at a greater financial cost and a decreased quality of life. You know, we focus a lot about the outcomes and the healthcare costs, but the quality of life is also important, right? So imagine if you can run with the kids, run with the grandkids because your health is in better shape, but because you're resigned to bad health, you know, you opt not to take care of it. These things don't necessarily have to be the case. Um, we can't ever be too busy for self-care. When you go to your primary care provider, we have calendars for routine screenings, for cancer screenings, blood pressure, cholesterol, mental health checkups even. Every year you should be getting what's known as a PHQ-9, right? And that will determine whether or not you're at risk for depression. Prevention and self-care go hand in hand. We're talking more about stress. We're talking more about taking breaks because we are human and the stress does take a toll. So we definitely have to keep burnout on our radar. I agree with Jim Rohn where he says, take care of your body. It is the only place you have to live. It is the only place you have to live. So following up with your PCP for preventative care or for abnormal findings is not just about healthcare choice. It's about saving your life, wealth building, future building. Advocating for yourself means taking responsibility for your health, breaking down those barriers, and setting examples for future generations. When you take the time to care for your health, you're also taking care of everyone around you, right? They always say that, you know, the children's health is really a reflection of the mother's health. So if you're okay, the family's okay. Same thing goes for the office, right? If you're okay, your team is okay because the balance is there. You're creating space so that you can actually connect with your team members. So don't wait. Take charge today. Schedule those follow-up appointments and take care of your most valuable asset, which is you. Thank you for this opportunity to address you. If you have any questions, I'll be glad to take them now.
Clap, 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 clap. Oh, thank you. Thank you so much for definitely speaking to us. And I do feel like as you were speaking, before you came in, we had checked in with each other and we have grown in such a way that we're getting closer to each other and we're able to really say what it is that we are going through and what it is that and I feel like you touched upon a few of those subjects. So thank you so much. I do know that this is recorded, and with your permission, we wanted to show at least a part that of your presentation up to our website, so that we don't only benefit, that other people are able to benefit as well. So if that is okay with you, we would much appreciate. Thank you so much. Thank you. Um, Now we leave it to questions. Guys, we have a doctor in the house, okay? We can choose to be superficial or we can really choose to take advantage of this forum, of this talk. So I know I my my next annual follow-up is actually at the end of the month. So I feel like a little check is going into it. And as we have, since we're going to have a whole people following, we're going to ask general questions as well as personal questions. And our membership, yes, most of them are work from communities of color, but as you can see, we do have allies in every color, which is wonderful, and we work together. Is there any, as far as following up with the PCP? I wanted you to perhaps go back to even as healthcare providers. I want to, even as healthcare providers, when you step into someone's office, you don't necessarily want to flag it. That's my experience. Let them do their work, please. And plus, you don't know everything. There are so many different specialties. So be quiet and be the patient or be the loved one, and let them do their thing. At what point do you think that is helpful and that is also a hindrance? I know there are people with different personalities, but how do healthcare providers actually, or how do healthcare workers, or how should they actually navigate that space?
It's actually a very interesting question, and each dynamic is different, right? So the bigger challenge that I have found is that healthcare providers treat healthcare providers as healthcare providers versus as
Dr. Flowers froze.
Let's see if we can get her back.
I'm guessing she may have been disconnected, so we'll just wait a second and see if she slides back on.
Dad.
Usually if somebody freezes this long, it means they've been disconnected. Said it was a very interesting question, Anna. She built it up and then disappeared.
I guess I'll ask a question in the interim. It's not a medical question, so that's good.
Mhm.
The updated I don't know what it's called, our updated
Work
plan.
plan.
Yes.
Yes.
Can you send that to us when it's absolutely finalized? Fantastic.
Yeah.
Dr.
It is.
Flowers.
Hi, sorry about that.
Dr. Flowers, you were getting to the meat of the thing.
I know.
Please go ahead.
Thank you for your patience. So I think the bigger challenge that we have as providers is sometimes when we go in as a provider, providers treat us as providers instead of treating us as patients, right? So there's a level of empathy that we tend to miss out on because we're used to detaching so much from the diagnosis that we're very, matter of fact with each other. We treat each other as colleagues in that moment, which we are. But now being on the other side, I'm a patient, right? I'm scared, just like another patient would be scared. I'm not the doctor in that moment. So that's one dynamic. And then the other doctor dynamic is to know it all doctor patient, who wants to be a part of all the decisions. And that's valid too. So I think each situation is unique, but the thing that's important in any dynamic is to treat one another with empathy and to create the space for healing. Yes. Absolutely.
Thank you. Any other questions?
I have a question. Doctor, could you talk a little bit about or offer some suggestions on how to prep for that PCP visit to maximize the time that you have when you're in a medical appointment? Because sometimes I've found that I've gone to an appointment or gone with a family member to appointment, and it's 10, 15 minutes. I walk out the door and then, oh, I should have asked for this. I should have said this. I should have inquired about that. And there's times that I've had some questions down and I don't know, the appointment just went in a different direction. And then I find that I've left the appointment and not really getting some of the answers to questions that I may have. So could you offer some suggestions on how to prep for that appointment and just with the mindset of walking away with answers or you know, just having that list of questions. Any thoughts on that?
That is a phenomenal question. Thank you so much for that question. So I find that the patients that get the most out of the appointment do definitely come with questions written down, right? But more importantly than that, part of why appointments get derailed is because the other information doctors have to work to get to, right? What are your current medications, right? So I cannot tell you how many times I'm looking at like dozens of bottles, right? They have duplicates and triplicates of bottles. So we spend time doing that. They don't remember who the cardiologist is. They don't remember, oh, wait, hold on, let me go into my bag. Oh, wait, I think the cardiologist is here. And, when was your last, mammo, your last pat? Oh, hold on, it's somewhere in here. So to answer your question, if you go in with a list of the things that we know we're gonna ask, right, for a routine visit, what are your current medications? When was the last time you refilled them? What are your current, let's say if you're hypertensive, blood pressure readings, sugar readings? Who are your specialists? What are their names? When's the last time you had your stress test, your colonoscopy? If you have those things that are the data points that we'll be looking for, there's more space and time to answer the questions, and the interview or the interaction doesn't go in a different direction. Does that make sense?
Yes, absolutely. And a second part of the question, a number of times physicians that I've encountered, it just seems like they are focused on getting to the next appointment because there's so many people that maybe they have to see in one day. And if I feel like I'm being rushed through an appointment for whatever reason, how is the best way to approach that in a way that's non-offending? If I feel like, you're just really trying to push me through here and I'm not getting the attention that I feel like I need. What are your thoughts on that? And I
Yeah.
recognize, sometimes it's short staff or the demands that are put on providers because of insurance plans. There's just so much that they have to do that sometimes you've got to go through your patients to get everything else done. So if you could just help out in that capacity.
Right. No, that's a very, very valid point. And, on behalf of any provider who has ever made you feel rushed, I do apologize. But the reality is we're having to see more and more patients per visit, right? Per day. One of the things that I always tell patients is you're the only patient that I'm concerned about at this moment, right? And so I try my very best to give each patient their due time. And being on the other side, I have had to tell providers as well, hey, slow down, I have a few more questions. I think it's important if you go in with the information that you know that they're going to need, that's a very big help. And, providers are human too, just appealing to their humanity to say, hey, doc, I know you're busy, you're probably really tired. I just have a couple of questions. If you could give me your full undivided attention, I'd really appreciate it in this moment. Right. And it does, it slows them down. And it's interesting. I heard a speaker, Dr. Dyke Drummond, he said there are two words that doctors hear very infrequently. And those two words are thank you from patients. Right. So I think just going in with the intentionality of, hey, I know you're busy. I really appreciate what you do for us. And I know you have patients behind me, but I just really need your full undivided attention in this moment would go a long way.
Terrific. That helps. That absolutely helps. Thank you for sharing that.
My
And
pleasure.
one of the sayings that you mentioned about you know, your health is your wealth. I've said that a number of times or something similar to that. But another saying that I wanted to share with everyone that I heard also, and I'm a believer in, is early detection is the best protection. Early detection is the best protection. So the sooner that you can get that, if it's recommended colonoscopy or a breast exam or to check the prostate if you're man, then anything that you can catch early on, your opportunity to deal with it, your chances are increased the earlier. So that's another saying that I love as well. And I just wanted to share.
Thank you for sharing that. Thanks for your question. Those are great questions.
Be, before we ask one more question, kind of briefly, as Gail was asking the question, are you able to give us a small bit of the background of that very question? Because that question alludes to, okay, what is the number of patients that that demand that a doctor, that a provider is supposed to see per day? And if you can kind of give us a little bit of that background so that we we understand from both sides, if that makes sense. If we're able to kind of understand from both sides, then that understanding comes in, and that empathy on the doctor as well.
Sure, absolutely. So I wouldn't necessarily say the number that a doctor is supposed to see, but I can tell you what the range is, right? So when we're in the primary care setting, it's typical for a primary care provider to see 20 to 25 patients per day. Okay. So now that's a lot. But now when you move into the urgent care ER setting, it's typical that we'll see 40, 60, 80. My record for one day is 96 patients in a 12-hour day, right? And I ended up doing, we're probably there about 13 and a half, 14 hours, right? Because there's no way. But we see whoever comes in the door. Right now, in a PCP primary care setting, the patients are more scheduled, but truly, in order to make an appreciable impact in terms of, you have to pay for your staff, you have to pay for your overhead, particularly in private practice, you do have to see at least 25 to 30 patients per day. That's a lot.
Thank you for that snippet. Yeah. Any other questions, please?
Can you repeat the question?
Oh, no, I was asking if we have any other questions.
No, and Anna, thank you for asking that question, because I have to remind myself, be sensitive, be aware of how many the patients, the providers trying to get through. And it's not like they're trying to intentionally rush, but at the same time, they have a number of patients that they have to see. So I think that was a great question. Thank you.
Absolutely. Does anyone have any other questions?
I guess I'll ask kind of a general question about insurance. I know that can get kind of icky, but as far as insurance goes, do you have any suggestions on how to maneuver insurance? I find myself like open season's always like during the holidays, and every year I say I'm gonna, educate myself on it, and every year I don't, and I just kind of pick things. Do you have any suggestions on how to educate yourself on what's being offered, what would be best for you and your family, like during that time?
So that is such a loaded question.
I know. Sorry.
Yeah, it's a big topic, and honestly, a topic that it's a topic all on its own. But one thing that I can say is you definitely have to familiarize yourself with your plan, right? So if you're looking to switch a plan, that's a different conversation. But if you have a plan, it's definitely important that you familiarize yourself with that plan. What are the deductibles? What are the co-pays? What's the co-insurance? Which are three different things, but technically mean how much money comes out of my pocket, right? At what point am I responsible, right? How much of a burden do I undertake with this insurance? Which these are things that you would have done when you enroll in the insurance, but then we forget about, right? So and every year it's new. Do you have an HSA, a health savings account, right? Or do you have a flexible spending account? Does that money roll over? Does that money not roll over? I know a lot of our conversations with patients, it's their gripe about, why do I have to pay this copay? Ma'am, sir, it is not, I didn't ask, it's your insurance company. Well, last year was $5, this year is 50. I'm so sorry, I don't control what the copay is, right? So definitely familiarize yourself with your particular policy. And I know a lot of independent, a lot of companies that are self-insured, another benefit to them, honestly, is to go through a third-party administrator, right? Because that can actually lower their premiums for both the company and their employees as well. So I've seen a lot of companies help in that way. And that's a whole different conversation. So.
Thank you.
My pleasure.
There is, Jessica has a question, has a comment, if it's okay that I do read it.
Say that one more
Jessica
time.
is, but this is from Jessica. It says, I'm turning 40 this year, haven't had a regular physician or have been to the doctors in years because I feel overall healthy. Do you have any suggestion for what I should be aiming to get appointments for? I'm also I also suffer tension in my head from overstimulation. Where should I start? Is the question.
Yes, so that is a great question. Thank you for asking it, Jessica. The first place I would start is a primary care physician and get a full physical. I would go ahead and do your basic labs, your CBC, check your thyroid, your kidneys, etc. At 40, I would also go for your mammogram. If you're suffering from tension in your head from overstimulation, I would wonder, do you have high blood pressure, right? What's your B12 level? But sometimes when your B12 level is low, you get like that tingly pressure sensation in the head. I would also look at your family history. Are there any histories of cancers? Because if there is a history of specifically colon cancer, then at 40, you would be a prime candidate for colonoscopy or at least a fecal occult blood sample testing. So that's where I would start. Make sure you get a full vitamin panel as well if you could. And it's not necessarily common for primary care, but more of a holistic approach to it. But knowing what your magnesium level is, right? Because sometimes if you're having that tingly sensation or that overstimulation, it could be that you're sleep deprived, but you may have an issue sleeping because your magnesium is low, right? So really having a full conversation with your physician to get a sense of your health, right? So we have the generic template of things that we ask people to do. And then there are things that are specific to you and your situation that's worth a conversation as well. And please do write your questions down so you can know that you've addressed as many as you can, because it's very possible to forget. So thanks for that question.
Thank you. Sorry, I was putting my son down. I didn't want to talk while he was just closing his eyes.
Say that again.
I said I was just putting my son down and I didn't want to start talking just as he was closing his eyes. They would have popped right back open. So that's why I put it in chat.
No, no worries. How old is your son?
He's he's about to be 7. He's 6.
Amazing. Excellent.
Yeah. Thank you so much.
Excellent.
That was very insightful, especially the high blood pressure, because I've been wondering why it happens, but it fades after a while.
Excellent. All right, any other questions?
I'm waiting for Liz to say something, but she ain't gonna talk. Any questions?
What did you want me to say, Anna?
Nothing. Only what you want to ask. But I apologize if I have put you on the spot, which I do more often. That's because I love you. We're good. That's good. Okay. We wanted to say thank you so much. We do appreciate your time, Dr. Donna Flowers. We could ask you many more questions, like definitely from the follow-up of, for example, I'm sure some of our people would think, okay, private insurance versus, for example, the we call it Obamacare, but do they get more testing or less testing? Like there could be so many more. So we are excited to have you back to have different conversations. More than that, more than this, we appreciate your time and coming. So thank you, thank you, thank you. Would you very briefly talk about your platform and what you talk about? So at least this is also helpful. You're reaching more people.
Can I talk about what? One more time, please?
Your platform that you do for the speakers that you call upon your podcast or so.
Sure. So I do speaking engagements. I'm not clear on the question. You want me to speak on the topics that I speak on, or if you can clarify for me, please.
I have seen some of your podcasts, some of the speakers that you bring on, and you speak about very interesting topics. So I just wanted to give you the opportunity to be able to either reach more people if you wanted to. Yeah.
I understand. Thank you so much for that. So the podcast is the Doctor's MBA, and it's at the intersection of medicine, business, burnout, and really all things. And so what I do is I have providers come on, and we'll talk about biohacking. We'll talk about, which is why I said get a full panel, not just your basic BMP. We'll talk about how to run a practice. We'll talk about things like how to increase revenue for physicians, right? So that we can take better care of our patients while they're at home and generate additional revenue through a service called RPM, or remote patient monitoring. We'll talk about how to grow a business, right? We'll talk about some of the challenges of having a business. So we really do speak on all things medicine, business, burnout, biohacking, things that help doctors be better doctors, and things that help physician entrepreneurs or doctors who have their own business be better business owners.
Thank you. What she talked about on the surface, it doesn't seem to be correlating with what she spoke about, but it really, when you think about it, it really does come in sync. And I would really encourage us to follow her and to follow some of the things that she is doing, because even as patients, hearing what they talk about does spark some interest, and it could further knowledge, if anything. Okay, so Dr. Flowers, thank you so much. We really appreciate you, and have a good night. Is there anything? Our next meeting is in March. We do encourage you to, you said you're from the NACP in where, which branch?
Montclair.
Montclair. So we thank the Montclair group for having you. And if you ever work within the Orange County, you can always come on our side. But we do appreciate you. So thank you so much, and thank you everyone for participating. I would say good
Thank
night.
you. Thanks very
Thank you.
much.